we have a medication which is known as PEP. PEP, it means pre-exposure prophylaxis. This PEP, you can use PEP once you think that you have been exposed to HIV virus. And I will give instances when PEP is necessary. One case, it's in case it happens that you have experienced or you have been raped. When you rush to the hospital, they will introduce you to PEP. PEP meaning that you are exposed. If you are exposed from that virus, it will help to fight the virus. Or in case you are working at the hospital and you have not observed the precautions, you have patients, you have not used gloves, you have used needles, and at some point accidentally you have injured yourself with the same needles. So at least you can go to you can visit an healthcare facility or the same facility and request for a PEP. That is post-exposure prophylaxis. At least it will assist you in fighting the infection. Another thing that I will also like to explain, it's about PrEP, something called PrEP. Remember, we have PEP and we have PrEP. PrEP is post-exposure. If you suspect, or in case you have your boyfriend and you suspect him, you suspect your girlfriend, you have that unprotected sex, and you suspect, hey, I'm not trusting my girlfriend anymore, I'm not trusting my husband anymore, you can visit a healthcare facility and request for PEP. And I'm sure the doctor you will find, if you find a doctor there, if you find a healthcare worker there, he or she will be in a better position to take you through those process. Of course, we have process for you for taking PEP. And when I say we have process for PEP after the exposure, we always say that at least visit the hospital within 72 hours. Yeah, so that is the first procedure. Visit the hospital within 72 hours after exposure. After exposure is after that act. If you suspect that needle has injured you, if you suspect, say, I've been involved in a rape case, so you visit the hospital within 72 hours. Then we have something else that I also want to share about PrEP. Also about PrEP you check before exposure. Let's say an instant that you have been dating someone who is abroad and he or she is about to arrive to the country. You don't know her status. Maybe this person is resistant, or you can't wait that you visit that you can't wait for him to be back or her to be back, so that you visit an healthcare facility for HIV test. So you can plan ahead and say, it's better for me to take a precaution measure. I go to the hospital and you'll be introduced to PrEP, yeah. So you start taking those medications before your friend or before your girlfriend arrives, and you will be in a better place of protecting yourself against the virus. And we also have something else that came up that is not just few months ago. It's for men. This one is working for men. It's called event-driven medication. This is a type of ARV, but it is taken by men. And concerning the event, event is something that you are planning to do or you are planning to attend. So if you are a man out there, you are planning to attend an event, and in that event I'm going to meet so and so, and this so and so you don't know her better, and actually when I meet this so and so, actually you are going to engage in sexual act. So if you are sure that this your friend, you are not sure if you will use a trust condom or you just want it raw, you can go to the healthcare facility within 24. You will be introduced to event pill that is taken 24 hours before the event. So if you want to see him, if you want to see her, you take that pill 24 hours before you visit, before you engage into the act, and you are sure you are well protected against the virus. But all in all, what we say that let's end the stigma about HIV and AIDS. Also, if you at any point, if you are couples and you find that your couple or your partner is infected with the virus, please don't leave your marriage, don't leave your boyfriend. You can still live as a discordant couple, meaning that if both of you can visit a healthcare facility, you will be guided on how to live positively. It doesn't matter she's infected, it doesn't matter he's positive. You can still live as a discordant couple, and you can still continue with your daily activities, daily life. You can still be able to get kids who are negative. That is through the use of medication ARVs. When these medications are used rightly, they will end up lowering the viral load, suppressing it and making it to be at zero. At zero means it is undetectable and it is untransmittable. You can't transmit to anybody. So let's continue and let's observe all the health measures. Thank you.